Welcome to Navigating Cancer Together. My name is Talaya Dendy. I'm a cancer thriver, cancer doula, independent patient advocate, and owner of On the Other Side. I use my experience to help others get on the other side of cancer. Gaps between the guidance, emotional support, and education that are needed and what one receives can be huge. This podcast fills those gaps by sharing stories, resources, and information about all things related to cancer and wellness. I interview guests from all walks of life who are living with cancer, caregivers, and those who are thriving on the other side. Also, I talk with organizations, healthcare professionals, and experts in the health and wellness spaces who offer complementary and integrative care. Join me. We are in this together. Hello, everyone. This is Talaya Dendy from On the Other Side Life, and you're listening to Navigating Cancer Together, the show that has something for everyone facing cancer. Why? Because everyone is different with different needs, beliefs, and perspectives. Thank you for joining us for this episode. I encourage you to open your minds and your hearts. Today, our very special guest is Darlene Greene. Darlene has over 26 years of experience in executive leadership positions across diverse industries. Currently, she is working to help people elevate their GHK-CU peptide to activate their stem cells, repair their DNA, reverse age, and get out of pain through the latest photo biomodulation technology. That is a big word, and Darlene is here today to tell us more about that and explain some ways what she's currently working on can help you live a healthier life and work through some of the aches and pains and other things that you may be experiencing. Darlene, thank you so much for joining us today and welcome.
Thank you so much, Julia. It's so nice to be with you. I appreciate your podcast and the way you're supporting people going through such a tough time.
Thank you, Darlene. I am so happy to have you here today. I really like to just educate people about different things that are available. So thank you for being willing to talk with us today and give us more education. But before we really dive into why you are here, please tell us more about who you are and what you do, Darlene.
Sure. So as a consultant helping people activate their stem cells, I really help people with all sorts of issues, whether it's cancer or my husband has early Alzheimer's, or people with Parkinson's, or people just with needing a new energy, needing to get out of pain for arthritis or other kinds of things. You know, our health is our greatest wealth. And so when you can help people get out of pain and feel better and have more energy and get better sleep, it really goes a long way. And that's either the person that's maybe going through the issue, that's going through cancer, or even the care provider. As someone who is a care provider, my husband's early Alzheimer's is really what launched me into this world. We were trying all the alternative approaches. His progression from mild cognitive impairment to stage 6A on the FAST scale, which is essentially a cognition of age 5, unable to dress themselves. He did that in 2 years. And normally that takes 13 years. Now, part of that's because he's early. He was diagnosed at 64. So part of it's because he's got the gene from both parents, APOE4/4. Well, in our effort, we went out of country 4 times. We got stem cells through IV and injection because that is the way, that was the only real promising thing. Even the best medicines that they are talking about in the news, first of all, they cause brain bleeds in my husband's body type. And second of all, they don't actually reverse Alzheimer's. They can sometimes help slow the progression. So we were looking for something better. Nothing was helping. Nothing, not the stem cells through IV 4 times at very high expense, not hyperbaric chamber, not ozone therapy. We followed the Dr. Bredesen protocol, which was very, very strict diet. We did gene mapping, we did microbiome work, we did deep sleep, we did high intensity training. You name it, we tried it. And yet the decline, right? The decline continued so severely, so quickly that when a friend of mine said, hey, we have a patch that helps you activate your own stem cells, I said, sign us up. We're in. What do we have to lose? We had nothing to lose. We had absolutely nothing working. And at the time we started, he was napping 3.5 hours a day, really falling asleep at 7. He wasn't able to engage in conversation. He wasn't even trying. He was no longer his personality. He was like a zombie. He was not trying to be funny, which is his personality. And so we began these stem cell activation patches. And in the very first week, he didn't nap at all. He was energetic. He was talkative. He was back to his original personality. He was funny. He was flirty. It was astonishing. And I was dealing with depression, pretty severe depression, wanting to cry every day. This was not what I expected for our life. I did not expect to be taking care of my husband, who's, looks like he's 67, but is actually cognitively age 5, right? That's a very hard thing. And I had broken my foot and sprained my ankle. I was in a lot of pain. I needed surgery. I was sort of stuck in a chair. I was having to ask my husband, can you get me a glass of water? And he would look at me like, I have no idea what you're saying. If I ask my husband to grab a banana, he'll grab like a pitcher of water, or, he just doesn't, the words don't connect. So this was just a really tough place to be. So I started patching, got out of pain immediately. That was the best I had felt. I couldn't believe it was better than Vicodin, better than Percocet, better than anything I'd ever tried. There's no drug, right? That's what I love about it, is there's no drug in this. And also had more energy. It just took a couple of weeks for me to actually experience the relief from the depression, just sort of lifted away from me, and other wonderful things happened. My headaches went away, my stress eating went away, my 4 autoimmune disorder issues from POTS and fibromyalgia and chronic fatigue syndrome and rosacea, and all of the things that I had been experiencing over time just disappeared. All the symptoms disappeared. And so I became very fascinated. At the time when I started, I would tell you, I didn't know that there were 90 clinical studies, didn't care, just bring it on. But now I know there are 90 clinical studies, there's a patent, and it's been proven. In fact, not only is it proven, but in the 2008 Olympics, there were over 300 people, Olympic athletes, were wearing our patches during the 2008 Olympics. And even now, Tom Brady wears the patches, the Kansas City Chiefs wear the patches, Serena Williams, David Beckham, Michael Phelps, big names, and yet it's relatively unknown. So that's how I got into the business. Is I began now, when I'm watching these huge effects on our health, and then also my family, first it's my family, right? Sis, you got to try this. Parents, you got to try this. Cousins, aunts, everybody. And they had their own amazing experiences. So that's how it began. And it's my passion. It isn't my day job. I actually have a day job that I love, director of client services for a network and technology company. But this is sort of my passion. I fit in the margins because I really wish I would have known about it 3 years ago. If I would have known about this 3 years ago, I can honestly tell you, I don't think my husband would be where he is today. I really don't, because we've seen so much improvement in him. Not only did he wake up and become himself again, but over time, other things happened for him. Like he regained the ability to whistle, and now he whistles all the time again. And he regained the ability to drum. His blood pressure dropped 37 points. He regained his sense of smell, which he lost 15 years ago. And so imagine getting that back after just 5 months of patching. So his hair came back. This would be a big one for your audience. Like, the hair issue is really tough for people going through chemotherapy or the things. There are people that are patching, they don't lose their hair as they go through chemotherapy. And if they are patching after, they get it back really quickly because you get amazing hair growth. So there are so many wonderful things about it. If you'd like, I'll describe a little bit about what the patch is doing, because it sounds like too good to be true. And I get it. I thought so too.
Mm-hmm.
I just was like, sure, I'm desperate. But when we're 30, half of our stem cells are dormant. When you're 60, they're almost all dormant. And so the fewer we have, the faster we age and the slower we heal. And so what this little tiny quarter-sized patch does is you wear it on your body, and it's using light therapy called photobiomodulation. So it's 100% safe. There's no contraindications or drug interactions. So you can do your chemo, you can do anything that you want, take any prescriptions you want. There's no prescription medicine, there's no prescription required. It's available in over 87 countries. And I know you have an international audience. So helpful for all of your audience. And it just gets mailed to your house and you stick it on and you wear it for 12 hours on and 12 hours off. And the way it works is very similar to, you know, how when you go out in the sun, your body makes vitamin D or melanin. That's photobiomodulation. That's a response in your chemistry as a result of the light. So you have light inside of you. And if I looked at you with night vision goggles, I would see the light inside of you. Well, imagine this is kind of like a little mirror reflecting within it is a hermetically sealed lattice structure of nanocrystals that are creating this lattice that's sort of like returning the light at a very specific wavelength back into your body. And it can be either direction. It doesn't actually even have to be on the skin. It can be on the outside of the shirt. It can be in a pocket. And it reflects that light in a very specific wavelength, causing the elevation of that peptide you mentioned. Who's ever heard of GHK-CU? I hadn't. But if you Google GHK-CU, you will find extraordinary, amazing benefits, many of which are anti-cancer. So not only does it increase stem cells, but there are people that are getting GHK-CU injections or wearing creams in order to elevate their GHK-CU. Now, it's not as effective as our patch. I think I heard one doctor say they injected someone 4 times in a day with a GHK-CU peptide, and still it didn't elevate their GHK-CU the way our patch did. But it does provide assistance to everything from the brain and the nerves to the heart to the lungs. It heals and improves tissue repair. It's an antioxidant and anti-inflammatory. So let's talk specifically about cancer for a second.
Okay, before we go there, let's pause. Let's pause. I want to get more information, Darlene, about where people can go to find out more about the clinical studies and the efficacy of these patches. I think that's really important.
Yeah, I love the data behind it. So if you go to the website, iamreverseaging.com, iamreverseaging.com, you can click on the button that shows you the patents, the 90 clinical studies, videos on the different patches. You can actually see specifically around GHK-CU. And so the things that I'm talking about, or we'll talk about in terms of cancer specifically, you can read each of the studies yourself. And I've now read all of the 90 clinical studies myself to really get a better understanding of what this is capable of as part of my job. But even if you wanted to try it without reading, a lot of people are more interested in testimonials. So there are testimonials on the website. There are videos of horses that are experiencing pain relief with the patches. There's no placebo effect for a horse. So that's an interesting, there are studies showing the benefits and even the thermal scans of imaging. So you can actually see some of the imaging in the studies, which is really cool.
Okay, thank you for sharing that. Please continue on about how it can help cancer patients, even caregivers, as you were a caregiver yourself, or you still are.
I still am, yes. And it's not an easy thing. So my heart goes out to everyone listening to your podcast, because they're probably listening to it for a reason. There's a lot that goes into this. But with regard to cancer specifically, there are huge anti-cancer effects from GHK-CU. So I'm going to talk for a moment just about GHK-CU and the studies specific to that, because I'm not allowed to make medical claims with the patch. They are intended for optimizing your health and general wellness, and we're not intended to treat, cure, diagnose, or prevent any kinds of diseases. We have to keep this in the general wellness category.
Yes.
So what we're going to talk about is GHK-CU. And certainly I can say the patches elevate your GHK-CU. So all of the benefits of GHK-CU, you can kind of make the connection yourself. All right, so we have that it topped 1,309 bioactive compounds as the Broad Institute computer recommended molecule for the treatment of human metastatic colon cancer. So that in and of itself is huge, right? It also reset the programmed cell death of human cancer cells. And that's human neuroblastoma, leukemia, even breast cancer cells. So I love that. And I love that it reset that programmed cell death without affecting any of the healthy cells. It actually repaired damaged DNA. It inhibits You may be familiar with NFKB-P65, which is believed to promote cancer growth. It inhibits NFKB-P65. It also induced cell differentiation, and it reset 84 genes to protect against cancer, to essentially growth inhibition or cancer inhibition. So these are very specific cancer results. There's also these anti-inflammatory effects. So we know that inflammation is so much the root of disease. And I've heard you talk in your podcast with people about how problematic inflammation is. There's actually a single patch that specifically, so while the stem cell activation patch will reduce inflammation, one of the problems with inflammation is it eats up stem cells. So typically with anyone with an issue, I'm going to tell them, I want you on the anti-inflammation patch and the stem cell activation patch combined so that we can lower your inflammation while we elevate your stem cells and activate them. And now you can really get your bang for the buck. And of course, you know, that anti-inflammation patch was huge and the best-selling patch we had before we had the patch that activates your stem cells, which was only developed 4 years ago. The company's been around 20 years. So the ability to lower that inflammation is just really huge. There are examples and testimonials. There's one, you can actually see the picture of this x-ray on my website that IamReverseAging.com. Nikki, who was a young mother, she was diagnosed with cancer in her lungs and in her neck, and essentially was told, you know, you have 4 to 6 months to live. She was choking. She could hardly speak. She was having to get fed via IV because she couldn't swallow. She started on a variety, several of the patches that are super helpful for people going through these issues. One of those patches is obviously the stem cell activation. One is the anti-inflammation patch. Another one is the glutathione patch. And I don't know if many of the people in your audience know the power of glutathione. I'm going to stop for a second and talk about it because it is so big. I do a lot of medical conferences, and I was listening to a medical conference this past week on just improving brain. And 3 different doctors said, if there was only one supplement that I could take, if you only limited me to one, it would be glutathione. Well, glutathione orally is not that effective. IV wise, it's actually hard to get through the gut. It's hard to get it where it needs to go because it has a very short life of 7 minutes, half-life of 7 minutes. It raises your glutathione levels maybe 27%, and it stays there for about 7 minutes. But our patch can elevate glutathione 300%, and it stays there for 24 hours. And glutathione is your body's master antioxidant. This is your immune booster. So when you have something like cancer or Alzheimer's or anything, you have to ask yourself, why did my body allow this to grow? Why didn't my immune system fight this? What's the environment like? It's not enough to just like get rid of the cancer and cut it out or chemo it out. You actually have to revamp and sort of repair, elevate, and improve the environment, including your immune system, so that it doesn't come back afterwards. And so, as an example, this glutathione, it protects DNA from damage. It initiates repair to damaged cells. It also protects and rejuvenates stem cells, so that's really great. It is actually known to increase length of life. The people that live the longest in the world have the highest levels of glutathione. When you look at people with cancer, you will find they have very low levels of glutathione. People with any kind of illness, that your body burns through your glutathione so fast, you just can't get enough of it. And so having an elevation of glutathione is just hugely helpful. It also does amazing things like increasing collagen, repairing and regenerating cartilage. It protects the myelin sheath, which is very important to people with Parkinson's. It detoxifies heavy metals. And if you were to wear the patch that's the glutathione patch, the anti-inflammation patch, and our stem cell activation patch, in just 2 to 3 months, you would find all spike proteins disappear. Spike proteins are there for anyone who's had the COVID vaccination or COVID. In fact, many people who have not had the vaccination or don't think that they've had COVID have spike proteins from offshedding. So spike proteins are really harmful to your lungs and to your gut and to your brain and to your heart. And they're going to stay there, and they're going to just keep creating complications for you until you get rid of them. So getting rid of them is really important. And these 3 patches do that.
If people have additional questions, do you offer a consultation at all for people?
I do, Talia.
Okay.
I'm happy to offer a free consultation to people. And I also can connect them with a doctor as well. Each week I do a webinar walking through the patches with a doctor on the call. And we answer questions for the very specifics. We record the first part of it, which is more presentation style, and then the Q&A we don't, so that it can be very private and people can ask very specific questions for themselves. Happy to do that. I really love doing that because I get amazing text messages every single day from people who have improved so dramatically. The woman that I was telling you about that had the cancer and is on my website, she was doing the X39, the glutathione, the Eon, and another patch. In just 5 months, her PET scan showed no cancer. So she had energy, her menstrual cycle came back, her skin improved, all of these things she could now swallow and eat, and all of these things came back. And there's a ton of testimonials on people who have had cancer and then they don't. And I'm not allowed to say that this cures
Mhm.
cancer, but I can just tell you they had it and now they don't have any symptoms of cancer afterwards. So
Okay.
it's really supportive of their energy, their sleep, their ability to heal.
Okay. Thank you so much. Can they just go to your website if they'd like to learn more, get a consultation?
And they can reach out to me on that website. They can read and watch videos all day long, but please reach out. There's a way for them to reach out and to say they saw me on your show, where they are located in the world, so that I can make sure that when I connect with them, I'm doing so respectful of their time zone. And we, happy to help anybody, not just the people, you don't even have to have an issue, right? You could just do this preventively to
Yeah.
stay healthy. Or if you're a care provider, boy, does it help. It helps when you feel better and you have more energy. You just do a better job taking care of people.
Yeah. Thank you for sharing that. Is there anyone, Darlene, that you would not recommend the patches for?
There's anyone who's had an organ transplant. If you have an organ that's not your own in your body, this is going to elevate your immune system so much. And so typically those folks are on an immune suppressant drug that prevents their immune system from getting too high because they don't want their own body to fight that organ. And this could elevate your immune system too high, essentially, to start. We haven't done any studies. We haven't tested that. We do have people that are on the patches that have had organ transplants, but it's the one person of all people that you would definitely want to lock arms with your doctor and go slowly and take this carefully because of the immune increase.
Okay. Thank you. Where can people get the patches and where are they distributed?
Yeah, 87 countries all over the world. They can order them from my website. I'd rather help them place the order, but they can order them just directly from the website. They get mailed to your house. If you do end up ordering, I'm typically going to reach out. I'm going to tell you the single thing that's most important. You have to drink water, lots of water. You're going to start detoxifying and flushing toxins. And if you don't get enough water, then it's going to like float around in there and get reabsorbed, and that's not good. So we want to make sure that you drink half your body weight in ounces in water. And it's really inexpensive. For the stem cell activation patch, it's $99 for 1 month supply. $99 for 1 month supply. And the anti-inflammation patch is $49 through introductory kits. So I can help people get the best deal. If you order without me, you may not get the best deal because you may pay $150 retail, or you may think that you have to do an auto ship, which you don't have to do. There are kits that I can help you start up. There's no obligation to continue to buy, and that you can get the best rate. So I like to help people just to make sure that they are getting the best deal.
Wonderful. Darlene, what would you say to listeners who are skeptical about the product?
Yeah, I was too. And almost everybody is. I mean, how can you possibly? I was so skeptical when I put the patches on and my pain went away on my own body. I thought, oh, come on, there's just no way. It must be this is the day, 5 months in, exactly this day that I'm going to be out of pain. But you wear them 12 hours on and then 12 hours off. And so when I took them off, in 10 minutes, my ankle was throbbing again and hurting all over again. So I was like, okay, wow. If you are in pain, it's really easy to prove to you that these work because I can get you out of pain in 15 seconds. And it's not a matter of if. There was 100% success rate in one of the studies and 96% in another. And that's not necessarily working on all the different ways that you can patch. The patching, if it's not working, and this is the pain patch only, it's the only one you're going to feel instantaneously. If it's not, we just don't have it in the right place, and I can help people get them in the right place. The other patches, the stem cell activation, the anti-inflammation, you're not going to feel that working on you right away. But 80% of people experience something positive in 3 to 6 weeks. Most people actually, lots of people in the very first week experience improved energy, deeper sleep, just mental clarity, some really important things. And so I understand skepticism. Bring it on. I appreciate skepticism. I would be skeptical too, but there is a money back guarantee. So you're not going to lose anything by trying them. And, light therapy has been around 5,000 years. People understand infrared saunas. They understand laser light therapy, blue therapy, red light therapy. There's something going on with light therapy. It's kind of exploding, and it shouldn't surprise you that your own body has an innate wisdom and knows how to heal better than a doctor. Doctors are sort of playing God when they get in there. They don't necessarily know what's going on. Your body knows what's going on. Your stem cells made you. They know how to fix you, and you don't even have to know what's wrong, really, right? You don't have to know what is it that needs to be fixed inside of me, because this will just help your stem cells go optimize and create homeostasis for your body.
Yeah, a lot of great points, Darlene. And it always comes to mind. There's a saying where if you give your body a chance, it will figure out how to heal itself. And sometimes we start doing all these things too soon and actually make it worse. So great information you've shared. Darlene, from your perspective, what tips would you give to people who are caregivers?
Well, the most important one is to really take care of yourself through the process. And I say that as someone who is trying to do that every day. I am working out every day. I am getting good sleep every day. I am drinking water and eating healthy every day. I am meditating every day. I am getting massages occasionally. I am trying really hard not to feel guilty when I take that time that I need to do the things that I need to do, like a massage or a meditation or just some sleep, right? I have got to take care of me. This is not a sprint. It's a marathon. It's every single day. And it's really easy in the very beginning, to just be sort of frantically obsessed with care providing. And I have worked really hard to step back and say, okay, I'm in this for the long haul. I have to take care of me. And that means occasionally doing something that may feel selfish. I'm going to go for a walk around the neighborhood. I'm going to bring in a care provider just so I can get out and go out with my girlfriends. I'm going to do what I need to do to keep my mental health happy and sane. And that makes me a better care provider. If I'm happier, then I'm more patient, I'm more loving, I'm able to really be in the present moment. I think the other thing is to have hope. I have a lot of hope. I will tell you, I was on an Alzheimer's support group today, and the way they talk is like everyone's saying, well, this is a terminal disease, and as the person dies, and I'm like, wait a minute. Dr. Bredesen has a protocol. 87% of people are reversing their Alzheimer's. Does anybody know that? Do you know that? There are alternatives where people are healing from cancer without chemotherapy, however they choose to do it. I don't care, but to have hope and not just go, oh yeah, this is terminal, sorry. And that's how everyone feels about Alzheimer's, and that's how everybody talks about it. And it sort of drives me crazy. I'm like, well, if you actually get the person's body moving and exercise and take care of any viruses and make sure that you get their microbiome healthier and you get them plasmalogens and you do some of these things, you can actually improve their body, activating their stem cells, right? There are so many things to do. And I think that if you are only listening to the white coat, the doctor in the cancer center or the Alzheimer's doctor at the clinic, then they basically say, here's where you are, come back in a year, we'll see where you are then. That there are no options, there's no alternatives. And so you kind of have to go digging for information. And that's where your podcast is so helpful. I would not have I actually then asked my doctors, are you familiar with these light therapy patches? And they said, oh yes, I love those. Well, where were you in telling me about them? Well, we have to be really careful about saying anything. We have to, and I'm like, oh
I
my
hear
gosh,
that a lot.
so
Mhm.
frustrating to me. So have hope, don't give up, and really be as gracious with yourself as you are with your person that you're providing, and give yourself a lot of grace along the way, because you deserve it. It's a very, very hard job. You didn't ask for it, but here you are in the middle of it, doing it every day. There's a special place in heaven. You're earning angel wings on earth, in my opinion.
That's the truth. Thank you for sharing those tips, Darlene. Is there any resources that helped you as a caregiver? I know the patches really helped you, to really optimize your health, but was there any other resources that you could mention?
Yeah, I do a lot of these free online medical conferences. They're 100% free. You can listen to them like day one. You have 24 hours to listen to there's one right now called Reversing Alzheimer's 4.0. There are some for cancer. There are some for microbiome. There are some for mold. I go sign up. It's free. And then, as I'm working out in the morning or on a walk or whatever, I'm listening to that. And I'm often listening to them at 1.5 speed.
Okay. Yeah.
As fast as I can listen to it, so I can get as much in. And then when it's really something like, oh, I need to slow it down, and like, let's really pay attention to that or take some notes on that. But I love that resource because it's free and it's educational, and it's not something you typically are finding out in your normal doctor's office. I would say your community, and you're just making sure you are you are getting support. It's not necessarily support like educational support on helping me as a care provider, but it's being able to pick up the phone and call someone and say, oh my God, he didn't know how to open a banana. Like, he couldn't open it this way or this way. He like peeled it open this way. I'm like, what? How is this possible? And yet he can go to Putting World and go golfing at 36 holes and beat his son. I don't understand. Like, so having somebody that you can talk to and just vent and just say, this is just the craziest thing, I think is really important, that community and that support socially in the moment that you need it, because you can't say that to your partner or your loved one. And yet sometimes things are so baffling.
Yeah. Yeah. Thank you for sharing that. Darlene, everyone's at a different level. Some of the listeners may just want the surface level information about the patches. Some may really want to get down and learn all the technology and terminology. Again, going to your website is the best
Mhm.
place, and reaching out to you is the best way to get as much or as little information as they would like. Please share your website again.
Yes, it's iamreverseaging.com. So IamReverseaging.com. And there are 2-minute videos, 3-minute videos, and there are 36-minute videos. There are little testimonials, there are NFL testimonials, there are doctor testimonials, and there are, horse videos. So you really can find about any more information than you probably ever wanted in there. But if you don't want to look at all of that and you just want to pick up the phone and call me, like, just know that I'll walk you through it. I'm working with people that are in their late 80s, some 90s, some that are patching their children. That you take the patch off, you can put it on your pet, although I'm not allowed to say that, but we do, because they're safe enough for your pets. They're actually dramatically improving the health of animals. So it's a really safe, no-brainer, in my opinion. There was an anesthesiologist and a 40-year physician named Dr. Peck. And I love his quote, because he says that this is the most significant medical breakthrough in my lifetime. I mean, and yet you're never going to hear about it on the news, by your doctor. Big pharma owns them. They own them. So you actually have an opportunity to just try something super easy. It's as simple as putting it on your body every day, 12 hours on, 12 hours off. It's not a matter of if it's going to help. It's a matter of when you're going to notice it's going to help. When do you notice improvement? Whether that's blood, cardiovascular, heart, brain. There are some really great pictures of studies on my website that are very quick visuals. Every 6 weeks, the cardiovascular system begins functioning as if it's 8 weeks younger. That's helpful. No matter who you are, that's helpful to fight all the things going on in our world. I love the simplicity and the safety and the fact that it's available to anybody all over the place.
Wonderful. As we wrap up our conversation, Darlene, what are the key takeaways that you like the listeners to remember from our discussion today?
Yeah, you can do something about your health. You can take charge of your health. Don't be a victim and expect everybody else to come in and fix you for you. You can do a lot for yourself. And this is one of the things you can do. It's not the only thing that you can do. I think it's the best thing you can do, but there are other things as well. There's energy healing. There's just all sorts of, there's microcurrent, there's pulsed electromagnetic frequency. There's, some of the other things that you can actually do to energize your cells. If you think about it, disease is really the cells aren't working properly. And we are biochemical and bioelectrical creatures. Mostly everyone's throwing pharmaceuticals and trying to hit the biochemical, but we're bioelectrical as well. So understand that there is an energy source there and that we can tap into that. So you can experience the relief, the pain relief. You can reduce inflammation. We all have inflammation. We can all use some extra energy and vitality. We can all improve our mental clarity and enjoy that. We could all use some cellular repair. We're just facing toxins and damage everywhere we are from the environment, whether that's the water, the food, the air. So we can all use a little help. And whether it's a preventive in nature or after the fact, this is going to be transformational for you. I'm not a public person. I don't speak. My Facebook page had nothing on it. People only knew when I had a daughter that graduated from the Naval Academy and I had another one graduated from the Air Force Academy. That was it. Like they wouldn't have known what was going on in my life. So for me to get on and talk on a podcast, it's not a simple thing. It's not very comfortable, especially talking about health and my husband's health, but it is important and critical. And I'm hoping that there's somebody that's listening that will take advantage and it will help them. It will help them. It will help the people that they love and it will make a difference. Because I would have loved to have listened to some podcasts like yours 3 years ago.
Thank you so much, Darlene. I appreciate you so much for stepping outside of your comfort zone to share this wonderful information that you came across. And now you are helping to educate others and helping others to improve their health and optimize their health. So thank you so much for doing that. There's just so much to learn. And if people are willing to learn about these things that are out there, ask questions. There's no dumb question at all, and take charge of your health, as you said earlier. Thank you again, Darlene, for
Thank
being
you.
here with me. I know you're a busy woman, so thank you for your time.
Thank you, Talaya, for what you do. I love your podcast. I have listened to lots of your episodes, and I think people should. And you'll learn something, whether you have cancer or even a cancer provider or not. Like I have learned a lot, and all of us have friends and family that have been facing cancer. So thank you for making a safe place for people to learn and to talk and to grow and to just be comforted by the community.
My pleasure. Thank you. If anyone's listening and they're interested in learning more about the patches and how they can improve your health, I will have all of Darlene's information, including her website and a couple of her social media links in the listen notes. As you've heard her say, feel free to reach out anytime if you have questions. I know Darlene will take care of you. She's a kind and sweet woman, I can tell. So I would like to thank you again, Darlene, for being here today. Before we end, I would like to give a shout out to the listeners. Thank you so much for joining us. Please share, follow, or subscribe so that you can easily find this podcast and listen again. Navigating Cancer Together is on Amazon Music, Apple Podcast, or wherever you get your podcast. If you're looking to expand your professional network, please join me on LinkedIn. As an active member of the platform, I personally invite you to connect with me there. Let's grow our connections together. You can search for Talaya Dendy, BCPA, that's spelled Talaya Dendy, BCPA. That is it for this Wednesday. And until next time, let's keep navigating cancer together. Take care. Thanks for listening to this episode of Navigating Cancer Together. I hope you found it helpful. Please be sure to subscribe, share, and tell your friends and family about it. For notes from the show and previous episodes, visit ontheotherside.life and check out the podcast section. I would love it if you join me for the next episode. Talk to you soon.